Welcome! It's Ashley from Demystifying Your Health. I am so glad that you're joining me today. In this episode, we're going to be talking about coronary artery disease. Most people don't think about their coronary arteries until something bad happens, right? And this isn't unusual. However, what affects your coronary arteries can affect your entire body. This is why it's so important to take care of them. So, what do you need to know, and how do you prevent issues with your coronary arteries? Let's find out. Coronary artery disease is also known as CAD or CAD. And it happens when blood vessels, the coronary arteries, these are the arteries that supply your heart with oxygen and nutrients, become damaged or diseased. Once the damage occurs, it's easier for cholesterol-containing substances, plaque, to accumulate in the area, and this is known as atherosclerosis. This causes the area that the blood has to flow through to narrow. So if this is your blood vessel, essentially if you fill the inside with plaque, it causes the space that the blood goes through to be very, very small. And this causes your heart to function less effectively. This takes a long time to develop though, usually over decades. So this is why most people don't even realize that they have it until it's in its later stages. There are several things that can contribute to the development of this process, such as smoking, a sedentary lifestyle, having high blood pressure, having high cholesterol, and having diabetes. Let's take a closer look at what symptoms you could experience and what are some potential complications. When it comes to symptoms of coronary artery disease, they don't usually appear until the condition is severe. The most common one is chest pain, chest tightness, or chest pressure. This is also known as angina, and it's usually brought on by some form of either physical or emotional stressor, and it'll go away once that stressor is removed. And the best way to describe why this is happening is when you think of when you're under stress, your heart rate naturally increases, and it increases the demand your body needs for blood flow to your heart. Well, under coronary artery disease, obviously your coronary arteries are narrowed due to that process, and this causes your body being unable to meet that demand that is being placed upon it. So you're going to have the chest pain as a result. Two other common symptoms are shortness of breath and fatigue. And once again, this is usually more due to physical exertion. And that is also because your body is having increased demand for oxygen. So your lungs are trying to do what they need to do to increase your oxygen intake. But unfortunately, because your heart's not functioning as well as it should, your lungs are able to function as well as they should. Hence why you're going to feel short of breath. And due to the lack of oxygen, you're going to feel tired or fatigued more easily. And some complications here with coronary artery disease are very serious. The first one is heart attack. And the reason why this can happen is when you think of the plaque building up inside your arteries. Obviously, little bits of plaque can break off and travel down your bloodstream and then clog off an artery that's further down that's a little bit smaller. This reduces blood flow to that area, which results in a heart attack. The other issue is if a piece of the plaque actually seals off the artery in that location, that can trigger a heart attack as well. With arrhythmias, this is an irregular heart rhythm. And this can be triggered due to the fact that obviously your coronary artery disease are impacting blood flow, which therefore impacts the electrical signals of your heart, and then can result in them beating irregularly. And then the other big one is heart failure. And this happens over time. Obviously, coronary artery disease develops over time. And once your heart is trying to compensate for the process that's taking place, but eventually it can't. It becomes weaker. And when it becomes weaker, it's unable to pump efficiently. And this results in fluid backing up in your body. when heart isn't functioning correctly and fluid's backing up, it's going to back up in two different places. It's either going to back up into your lungs or it's going to back up into your lower extremities. And this is known as heart failure or congestive heart failure. And this is why it's so important to try to prevent coronary artery disease, because it places you at risk for these very serious conditions that are completely preventable in most cases as long as you're preventing coronary artery disease. When it comes to treating coronary artery disease, there are several different options, but the first and most important, and the one you're going to be starting with, is lifestyle changes. These are absolutely critical because none of the other ones are going to make a difference if you don't address these factors first. So, what are these? The first is to not smoke. So, if you've never smoked, awesome. If you are currently smoking, talk to your doctor about quitting. This is absolutely critical right here. You also want to be physically active. And while obviously your medical conditions might limit to the extent of your physical activity, it's important to get some form every day. Talk to your doctor about what you can do currently and develop a plan on the go forward. You also want to eat healthy. So this means reducing and limiting your salt intake, eating plenty of fruits and vegetables and whole grains and lean meats. Reduce and manage stress. Obviously, stress places a lot of demand on our body that we don't need. A lot of us are under chronic stress, so you want to be able to manage it and reduce it to the best of your ability. And then you want to control chronic conditions. Here we're talking about high blood pressure, high cholesterol, diabetes. All of those are absolutely essential to be managed appropriately, so that way you're not going to have issues with coronary artery disease, or at least minimize the issues you could have. And then a lot of people are going to need to take some form of medication. Some of these are only temporary until obviously the lifestyle changes start kicking in and you start seeing improvement. Other times the damage is so severe to the person's heart that they're going to need to stay on some form of medication for the rest of their life. So what type of medicines are you going to be potentially on? First ones are cholesterol modifiers. These are to help reduce the amount of cholesterol within your body. The next ones are anticoagulants, which most people know as blood thinners. While they don't technically thin your blood, what they do is prevent platelets, which are the clotting factors, from sticking together. Hence why they're called anticoagulants, because they don't allow your blood to coagulate or clot. And an example of this is aspirin. That's one that's over the counter that a lot of people take. Obviously, there's prescription forms, and your doctor will help you decide which one is best for you, depending on what you need. Another big class of medicines for coronary artery disease is beta blockers. And this has a twofold process. It reduces your heart rate and blood pressure. By doing this, it decreases the demand on your heart to get blood, oxygen, and nutrients out to not only your heart, but the rest of your body. Two other medicines that impact blood pressure, because they work a little bit differently within the chemical structures of your heart, are ACE inhibitors or ARBs. And these, it'll depend on what your doctor feels is best as far as controlling your blood pressure. There's which one of these you need. You might need a combination of both, a combination of all three. It takes a little bit of tweaking and trial and error to figure it out, but your doctor will definitely help you with that. And then the last medicine is nitroglycerin. And this is usually reserved for people who have chest pain and angina. So if you're having an episode, you would most likely take nitroglycerin in that case to help dilate your blood vessels. That's the point of nitroglycerin. It's going to dilate your blood vessels, which immediately decreases the demand that your heart has placed on it for oxygen and obviously trying to get that oxygen to the heart itself. Some people take nitroglycerin daily, but usually this is for more severe cases. And there could be a couple of procedures a person with coronary artery disease might need. And usually these are for emergency situations only, such as when there is a piece of plaque or a clot, something that's blocking a blood vessel and it needs to be reopened immediately. Otherwise, obviously, the person can either die or suffer significant long-term damage to their heart or somewhere else in their body. So the two main procedures are angioplasty with possible stent placement and coronary bypass surgery. So with angioplasty, usually involves putting a catheter in through the artery in your groin, feeding it up to the person's heart, finding where the blockage is, going in, and on the tip of the catheter there's a tiny balloon that the doctor then inflates to break up the clot And then they can leave behind a stent that is fed over the catheter and placed into the exact spot to help keep that artery from collapsing. Obviously, with coronary bypass surgery, this is also known as open heart surgery. And this involves actually going in and bypassing the blocked artery with either a synthetic made artery or an artery or a vein from somewhere else in your body that is then transplanted to that area. So as you can see, coronary artery disease has a lot of different treatments depending on the severity of your condition. The main focus is always going to be lifestyle changes because this is going to have the greatest impact over the long term of your life here. Obviously, medications are the next big factor here, and hopefully you won't ever have to have any of the procedures done. When it comes to preventing coronary artery disease, there are several things you can do. And as we talked about in the treatment section, it's the same thing in the prevention section as far as the most important thing is lifestyle changes. This is absolutely critical to preventing coronary artery disease. Obviously, we know coronary artery disease takes a long time to develop, so this is a lifelong process to prevent it. And in order to do that, you need to not smoke. So as we mentioned before, if you are a smoker, find out ways to quit, talk to your doctor. There are plenty of resources to help you with this. And if you don't smoke already, great job, keep it up, don't start smoking, or vaping. Vaping is just as bad as cigarette smoking, cigar smoking, all of it's bad. Our bodies are not designed to take in any chemicals by inhalation. We shouldn't be inhaling any of them. Next big thing is exercising regularly. So for each person, the level of exercise is different. The key thing here is you want to move. Your body is designed to move. So you need to get up, several times throughout the day, take breaks. If you sit at the desk all day, make sure you're up and moving around. Every hour, take a 10-minute break. Whether you need it or not, you need to get up and move. And then you need to fit in at least 30 minutes of some form of exercise every day to the best of your ability. And I know it can be hard, so if you need to break it up into smaller chunks, remember, always moving in some fashion is better than no movement. Then the next big thing here is eating healthy. And as we mentioned before, you want to limit your salt. You also want to have a low-fat diet. You want to eat lots of fruits, lots of vegetables, lots of whole grains, lean proteins. This can be meat, but it can also be things such as beans or legumes. There are plenty of options here, so if you're a picky eater, there are things that you might enjoy that you've never even thought of before. Key thing is you've got to find them and then start incorporating them into your diet. These two here, exercising and eating healthy, are essential to helping maintain a healthy weight. And when our bodies are overweight, it places us at risk for so many medical conditions that can precipitate coronary artery disease. So you want to be able to maintain a healthy weight to prevent all the other conditions, but also coronary artery disease. And then the last big thing we talked about briefly before is reducing stress. When our body's under chronic stress, it causes all these different hormonal changes, different chemical processes to occur. These are horrible for our body in many different ways. This is why you want to not only just reduce the stress, but manage stress. Of course, everybody's going to have stress in their life at some point. Sometimes it's going to be a longer term event that's causing stress. The key thing is keeping it under control so it doesn't impact your body negatively. So by following all these things all of the time, this is going to help reduce your chances of having coronary artery disease. No one wants coronary artery disease. So starting today, do everything you possibly can to prevent it from happening. If you already have it, talk to your doctor about the best ways to manage it and treat it so that way you can live your life to the fullest extent possible. Thank you for joining me today. If you found the information to be valuable and helpful, please like, share, subscribe. If you have questions or comments, put them below or send me a message. I'd absolutely love to hear from you. And until next time, stay healthy.